Ready?
Good. Okay, we are recording. Hi everyone, and welcome to my lovely panelists here, who I'll introduce you now to in a few minutes. And welcome to everyone who's watching us live on Zoom. So I guess these lovely ladies I've connected with over the last number of months, years, and so forth, and I think I know them as great warriors in terms of women's health, women in menopause, and I think just, life in general. So we have Lavinia Winch. I'm not sure how people will see it, but I'm thinking you're up here on the left hand side. So we have Lavinia Winch from Yes Organics. Lavinia was actually a medical liaison with Yes Organics for 10 years, and she's now brand ambassador. And I think most importantly, Lavinia is your patient advocate. And you've got a huge interest in women's health, as I know from the many conversations I've had with you. And you're on a mission to help as many women as you can, I think, not just in the UK, but around the world, in terms of not just menopause, but sexual health as well. Sam, this is your first time we're on webinar together, so welcome and thanks for joining us. Sam's background is actually nursing, and Sam is based in the lovely Tunbridge Wells. I had the pleasure of living near there when I lived in London many moons ago. And Sam is also the co-founder of Joe Divine, and by the end of tonight you'll be very familiar with Joe Divine. I guess what I would say, what I know so far of Sam and all our interactions, not just directly through myself and Sam, but also I know through many women I've worked with, is Sam, you're so generous of your time when women contact you in relation to issues they're having with vaginal atrophy, with painful sex and so forth. And I think the passion and dedication that you take with women is simply amazing. So thanks for coming on tonight. I personally am really interested to hear about how we're going to change our bedroom antics.
Thank you.
So it'll be lively. And last but not least is my lovely friend Emily. Emily, as I think everybody knows, Emily is Ireland's much loved sexologist, and a vivacious character, I always think, full of fun and smiles. And Emily is on Emily's mission, as if you joined the last webinar we did, is really to make it safe and normal for all people to talk about sexuality and to normalize it. And I think very much for us here in Ireland, it's probably to take away some of the shame and some of the taboo that we know exists when we come to sexual health. So welcome, ladies. I'm thrilled to have you on, and I know we're going to have an exciting and fun hour ahead. So I thought to start off, we have, as I said, we've loads of questions, but there's a few things I thought we'd just chat about beforehand. So I guess I can share my story in terms of my menopause journey, and particularly from sexual aspect. So I guess I'm 49 now. I'm going to be 50 in a few weeks' time. Yay!
Hey,
I'm dying for these bloody periods to stop, but that's not happening. But I guess I started perimenopause when I was 43, 44, and I would definitely say libido was the one thing that came knocking at my door pretty quick, and a drop in libido. I would have said my husband and I, our sexual relationship has always been very healthy, but I think certainly when kids come along, things do change. And then I think for me, when I came into my early 40s and I was in the early stages of perimenopause, I definitely noticed my libido starts to drop. And so I guess as part of looking at, other symptoms that came on at the same time, which was, I was working at the time, and I certainly would have started, um, I'd never experienced anxiety before in my life. And I certainly started to have small bouts of it. So pretty quickly, I guess I started to get a handle on things. But it's one area. I don't underestimate the impact that it can cause when your libido is suffering. And I certainly would have said, we've a good healthy relationship, and we always talk about things. And I think that was probably one of the biggest things for us, was that I was able to say, look, this is why I'm just not in the mood, and this is the reason. And I knew what was going on. And I think then, I did make some changes lifestyle wise and so forth, and I did start using, because I certainly wasn't feeling as comfortable for me as it had done in the past. So I did start using lubrication, and I used the lubricants. And I think that most definitely changed things for me. But I will say it didn't happen overnight. It certainly, I would have said it was at a low for, I'll be very honest, I would probably said a year or two, that we weren't as regular as we used to be. And I'll be very honest now, and I won't go too puce in the face, but I will say at the moment it's in a very positive place.
Oh, brilliant.
But I think it's just it goes up and down, right? And I think that's very important for women to understand that it's not like there's questions here somewhere in terms of how many times, and we'll go through them in a few minutes, but there's no straight answer to any of this, right? In terms of, it's not one size fits all. And I think that's certainly probably, what I've learned. And as I've said at different times, I've never had a hot flush in my life, not yet, but I've had other things. And like us all, different things happen in menopause. And I think the one thing that I know in Ireland we are not good at talking about is the sexual aspects of it. And I think, Emily, you can, you're probably even more familiar with that than I am.
Well, I get a skewed idea of Ireland because everyone talks to me about sex. But
that's like me in menopause.
But yeah, no, it is. I'm 49 as well. I'll be 50 in February, and I'm in perimenopause, and I have lots of ups and downs with it as well. And I think, though, what you're saying about our libido naturally goes up and down, even without menopause or perimenopause, that's the case. And I think we're not taught to expect that. We're taught to expect ourselves to be kind of animatrons who can just be on full throttle all the time. And I get people coming to me quite a bit, and they say, oh, my libido's on the floor, and I'm asking them what's generally going on in their lives. And the things people are coping with on a daily basis and not making any allowances for that I've been going through a lot of loss in the last number of years, people close to me dying, and it knocks my libido. It just does. And as a sexologist who's always, proponent of great sex and of working on your libido and ensuring that you're in touch with your body in a loving way, that's been a journey for me to experience the other side of it, where I'm just flatlined. And it is that thing of trusting that you're natural, and we are cyclical creatures, and everything has to rest, including our libido sometime. And I'm just beginning, I think, to begin to come out the other side of that, and I'm beginning to, look at things with a little bit of appetite again, and it's a wonderful feeling. But I know that a lot of people on that score can actually doubt their relationship. They can doubt their functionality. They can blame themselves, when actually it is just a natural reaction. And then you add menopause, and that is the thing that has stigma attached to it. And I think people, because we don't talk about it, people really don't know what they should expect and what's okay to expect. And if you're not talking about it, it's so easy to internalize the blame. It's so easy to blame your partner. It's so easy to think, well, that's that then, because that's kind of what we're taught in Ireland.
Yeah.
It's still kind of an expectation that once you hit menopause, you know, lucky women who hit menopause, they can finally have an excuse to say no to sex. Well, that's, you know, that's not okay.
Yeah.
I mean, it's okay if you want to, if that, again, if that's what works for you and that's what you want to do, of course, but it's to know that it doesn't have to be that way. You know, we're living so much longer now. We have the same amount of life after menopause for a lot of us as we had before it. So to cut our sexual lives out of the equation at that stage due to lack of education and stigma, it's a real pity, you know, and it's not necessary.
And plus the physical connection, it's, you know, if you think that, you know, average age menopause 51, 52, and that then you're like, there is to be no other physical intimacy, that's a lot of time to go without having that intimacy. And I know for me, God, I'd miss it massively, you know. But like Emily, like what you're saying there, and you'll see it when we talk about some of the questions, and we got a real sense of that from the last webinar we did with yourself and Diane Danzebrink and Jane Lewis, in terms of the issues we have here in Ireland. Yeah. And I think I was certainly, I know we've issues. I was probably more bowled over with a lot of the messages we got for that webinar in terms of how deep it does go. And I think that's one struggle that we have on top of just menopause itself and the symptoms of it, is the fact that there's this whole other part of life that for a lot of women, you know, sexual pleasure isn't actually something that they feel is a normal part of life, right?
I mean, I meet women regularly who think it's shameful to enjoy sex. And now, in this day and age, because there's no education to replace, well, there is a little bit, but not if you're not in school. So if you're in school at my age, you know, there was nothing, of course, about pleasure. I mean, there still generally isn't, but we were still then getting messages from our grandparents that, you know, my mother she was English, actually. She was from Yorkshire, and my mother was told by her mother on her wedding night, she was a virgin, literally to lie back and think of England.
God,
like, you know.
God.
So my mum didn't have an awful lot to share with me about how to be a sexual person. So I think, a lot of women really don't feel that they want to be that kind of woman who, you know, enjoys sex, because what does that say about you? And yet they usually find the contradiction in that value if they just keep talking for a few minutes. Yeah. Because it's very clear and very obvious quite quickly in this day and age that that kind of woman is probably having way more fun and is probably enjoying much better sex and is probably having a closer relationship with her partner or partners because of that. So, you know, we know that, but yet there's this contradiction for women in Ireland about being slutty or, you know, something.
Well, I think certainly sorry, Sam, that's how we were brought up. You know, I think the next generation is going to be very, very different. But I think, Emily, our generation and the generation ahead of us definitely had all that stigma and all that. Let's be honest, there's no sex before marriage. That was the way it was. And
then not a sex after marriage once you die.
I mean, I have to say, I'm very glad. I am very glad and it wasn't because of my family background, because my family were deeply religious, but I certainly, my own, I guess, self-exploration into the world and into life, I didn't follow that, and I'm really glad I didn't, because I do think it's healthier that there isn't necessarily just one sexual relationship. That's my personal view. Sam, sorry, you were going to say something there?
So I was actually going to say about the shame conversation. We have that an awful lot at Joe Divine. When someone comes to buy a sex toy for the first time, Often we speak to people who've lost their partners, so they feel guilty for doing that. But often they'll say at the end of it, oh, actually, I think he'll be quite happy because we had a good sex life, or we didn't have a good sex life. And Paul and I both get incredibly sad when we hear those conversations, the shame that is wrapped up in sexual pleasure. We're having women having their first orgasms in their 60s, 70s and 80s. No one should ever have to wait that long for their first orgasm.
No.
You know, sex ed hopefully is going to get better, fingers crossed. But we need sex ed for adults, and I just think it's just very, very sad, this conversation. And also the other thing, healthcare professionals, being a former nurse, you know, female pleasure is completely overlooked. So it's not going to be brought up in the doctor's surgery. It's not going to be brought up by the gynecologist. I work with brilliant healthcare professionals who are so proactive with people's sex lives. They recommend our toys. They are brilliant. They have them in clinic. They whip them out. You know, they are so good. And they open up these conversations. But goodness me, they are a small group of people. We need every healthcare professional to be talking like this, especially if they are treating people where they've got menopause, gynae issues, they've gone through cancer treatments, post-childbirth, the aging process, anything that impacts upon your sexual intimacy and pleasure and your sexual function, rather than just viewing us as these, you know, women who have babies, and not everybody has a baby anyway, you know, and that's it. And I just said, you know, go away, we've treated your cancer, rather than, well, actually, I had a really good sex life before I had cancer. I quite like to carry on. What can I do? So there is that. We have this combination of, if you feel the shame, you're not going to bring it up to your GP. My own GP calls sex contact. He's a guy in his early 40s. Thankfully, I see a brilliant female GP for menopause. We talk about sex all the time whenever I get to see her. But he's hopeless, and he's done it with my 20-year-old daughter. Now, come on, why are you calling it contact? He doesn't stand a chance with me, because obviously what I do, I think it's quite frightening when I go in. But, you know, for goodness sake, if we've got medics and nurses and healthcare professionals not able to talk about sex, when I hear about menopause doctors saying, well, I don't talk about sex because it's not my job and I'm too embarrassed. Well, quite frankly, if you're working in menopause, you should be able to talk about sex. Working in gynae, you know, if you're working in oncology and cancer treatment, you should be able to talk about sex. So that's me, the shame and healthcare.
And Sam, like when you talk about the shame, and I know there's some questions on this that we'll go through in a few minutes, but you know, where like in terms of your products and so forth, like where do you recommend? So say you know, there's been several emails that came in from people saying they were not comfortable with masturbation or with any form of self-pleasure, and you know, where do they start? You know, and what you know, I know Emily will have views on this as well, but you know, what would you say in terms of if someone comes to you like that, what is your recommendation in terms
we obviously we have people who don't even know where their clitoris is, you know, or even what to do with the toy, you know. So generally you start off with anatomy. But I always say to people, well, have you actually looked at your vulva in a mirror? Because that's something that we recommend in sex education here in the UK, to actually examine yourself. It's really important, because so many people don't. They don't actually know what they look like. They don't know what's normal. But also I say to people, well, do you masturbate? And they have no, you know, they don't know, I don't do that. But they're often paying to buy a really big toy. They've never used a toy before, so we often direct them to a small toy. But, you know, they have this idea in their head, but they actually don't know. And I often say to people, well, this toy can be used externally. Well, what do you mean? Well, on your clitoris. So I think if you don't have that education or awareness of your anatomy, and that has to be the first thing, we need to get used to using the right terminology, you know, and actually becoming familiar. I end up bashing them over the head, and I know you're not bashing the head, but showering them with professionalism, basically. You basically say, you know, you just come out with it all, you talk in a professional manner, there's no salaciousness, it's no you know, this is so disgusting and terrible. I'm going, this is normal, our products are recommended in the NHS by healthcare professionals, you know, this is how normal they are to use. And I think people go, oh, and they answer, I mean, you know, and then people come back and they'll buy stuff and they say, this was amazing. And I wish I know. I mean, we've got our oldest customer's been 95. I spoke to a 92-year-old lady the other day.
Wow.
She bought 3 toys. She said, that's enough now. That'll keep her going. You're never too old. This whole thing,
brilliant.
God, no, it doesn't.
but it is like the number of conversations I have with women, and like that, they do not. There is a huge there can be a lack of understanding in relation to our anatomy. And one of the things that I've been really trying to advocate is trying to do a monthly check, where you do a monthly breast check, but at the same time you also check your vulva. So you lie down on the bed, you get your mirror, and you become familiar with how everything looks. And, you know, part of that then is, you know, you're also trying to talk about, you know, the vagina is internal, what's external, and just explaining, because I'll tell you, we got none of that over here. I certainly didn't, you know, when I was in school. So, you know, it wasn't anything.
The very simple problem with it is teaching that the vaginal canal is the women's sex organ versus the clitoris is the sex organ. That would help. But then we'd have to talk about the clitoris, because it's got no other purpose. So they can just about mention the penis being the sex organ because it's undeniably there and it sticks out. I'm sure if penises weren't sticky outy, I'm not sure how much better it would be for men, but I think, you know, that would be a good place to start, you know. Even mentioning that women have a clitoris would be useful. But saying, and I know, that, really basic, you know, saying that the vagina is the female sex organ sets us up to go wrong in the first place, because then women are thinking and expecting, and so are men, and everybody who owns vaginas and penises are expecting that the vagina is going to produce orgasms more than is realistic to it, you know. So there's a lot that goes wrong just with that one little thing they could tweak. But they can't do it because then it's pleasure.
And I know there's one of our viewers has just put in a note there that she teaches antenatal classes, and she finds even at antenatal classes that women are very embarrassed when she starts to talk about vulvas and checking, and same when it's postnatal. I mean, that fundamentally is so wrong. It's so wrong. Like, I can remember after my first child, I had a lot of tearing, and I quite a bit of stitching, and I can remember afterwards, for a good while afterwards, I was keeping an eye on the scar just to make sure everything was healing properly, and that I could understand things were obviously looked very, very different. But it's natural. It should be the same as looking in your mouth, brushing your, you know, it has to be made more natural, I guess, is the thing. And I think, Lavinia, that's part of the work that you've been doing in terms of you know, being a patient advocate, is trying to normalize a lot of this, right?
Yeah, but actually it's interesting that you mentioned postnatal, because I think all of us here have got our own experiences, and that's part of why we're so passionate about women's health. And mine actually started postnatally. I didn't know that when you breastfeed, you have some vaginal dryness, because the prolactin that is there to produce the milk suppresses the estrogen. And if there's no estrogen, there's very little natural lubrication. And I sent my husband out to get some KY, because that was all there was in 1980, bearing in mind that I'm now 68. So I'm almost a different generation to you guys. But, you know, I'm actually quite proud of the fact that we knew that there was such a thing as lube. And so that helped tremendously. But what I didn't realize was how a product like KY was going to cause huge amount of irritation and thrush, and oh my God. So that was the beginning of my journey, which I have to say went on for 30 years. And where I'm incredibly lucky, because I had no sex education from my parents at all, just nothing. I had a boyfriend when I was 16, and eventually my two brothers said to my mum, I think she ought to be on the pill. And I was going on holiday with him, and my mum had a friend who was on the board of governors of the Brook Advisory Centre, which is now Brook, and she sent me along. And that really, you know, I sort of learned a lot more. But I was just being very, very lucky to have a husband who was able to be incredibly open. And for us, communication through all the issues that I've had through my life, communication has been the key. And just quickly, talking to Kate Moyle the other day, she said to me, she's a psychosexual therapist, she said to me, I talk about CCL, and that's communication, curiosity, and lube. Those are the,
Yeah.
the key things, you know, that are really important in terms of your sexual relationship. So, you know, as you said, you know, to talk about the reasons why your libido may be very low, and to understand, and for your partner to understand what you're going through, that can help tremendously.
Yeah, I think, you know, if there's anything when it comes to any relationship, communication has to be number one. And I'd see that not just from the sexual health part of it, but menopause journey, communication is so critical for family relationships. It's so important, you know. So just on I think, let's just go through some of the questions. We can still chat about different things as they come up, but yeah, let's just go through them, because I'm just conscious of time and so forth. Sam, this is probably one for you. I have a good sex life with my partner. I'm open to making it better or changing it. How or what would you recommend I could introduce in the bedroom?
Yes, she's got toys.
Oh, brilliant toys! Bring them on.
I've got a bed covering
Excellent.
bullet vibrators. These are the simplest things you can introduce into your sex.
Sorry, did you say bullet?
Bullet? Because of the size of a bullet.
Lipstick.
Clitoral stimulators. They're for your clitoris. This is a problem. 75% of us orgasm through clitoral stimulation, and you know that's why people don't orgasm through vaginal penetration, because they're not getting the right clitoral stimulation, and people don't know how to stimulate their own clitorises. Bullets. If you are curious about sex toys, or even if you're very nervous, we always say start with a small, simple bullet toy. I've just put a video up on Instagram today about the bullets and our clitoral stimulators. But it's a really good one. These are gender neutral. It doesn't matter if you've got a vulva, vagina, well, they're not for your vagina, a penis, up and down the shaft of the penis, underneath the testicles, underneath the perineum, on your nipples, on your labia, on your clitoris. They are really, really good fun. They are inexpensive. The most important thing to say is we only sell skin safe products. And so that's yes. And our products are sex toys. So they're made from glass, metal, ABS, plastic and silicone. No jelly, latex or rubber. There are fake and used products out there online. There are unreputable sex toy manufacturers. So, you know, I spent 12 years doing this. I am incredibly passionate, and we are a really good sex toy company. I am promoting this because people don't know what they're using. The lube, KY destroyed my sex life and our sex life and my intimate health in my 20s and 30s, and led to vaginismus. I mean, Lavinia knows my story. I'm so angry about it. But sex toys, so a simple little bullet, you know, but you know, they don't just
just to say, not that they're good for everything except the bum, not to put
oh no, but also, and not for your vagina. Basically, they are external. So you know, this one looks like a pebble, doesn't even look like a sex toy.
What was that one? What's that last one?
That's the Mimi Soft, the Juju Mimi Soft. It's got a squidgy tip. It's my favourite. It's got lovely deep rumbling vibrations.
Can I just say about that last one you just showed, for women who are, I think for women who are postmenopausal and starting, sometimes that broader one is nice, because sometimes the bullet doesn't give enough cover.
No, and it's actually
massage the vulva, which I think is a lovely part of self-loving and getting warmed up. I like the bigger surface area for sure.
You know, and I mean, this one looks like a spatula. Not from my kitchen. The whole thing vibrates. The end goes inside your vagina. That's for stimulating your vulva. Then you put that inside your vagina, you bend it up, you get dual stimulations. You get internal and external stimulation. Okay. It doesn't look like a sex toy. People have.
What's that one called?
It's called the Marvelous Lover, and it really is. Okay. People think of the Rampant Rabbit. We've moved on. It's 20 years since that was brought out. It actually was a terrible product. It gave me thrush, the one that we had. You know, it was made from jelly. It was awful. Yeah, so things have really moved on. You've then got toys that don't vibrate, and these are brilliant. These are air pulse toys.
These are fantastic.
These gently tease and caress the clitoris, because that's just what you see on the outside is the tip of the iceberg, and then that sends the sensations through the clitoral tissue which surrounds your vagina. You leave these in place, and when they go in place, they go quiet. You turn them up, and basically you just lie back and let them work their magic. It is nothing like a vibrator. So often women in menopause who are experiencing decreased sexual sensation, because that is a real problem because of the changing hormones, we've got women having their first orgasms of this, you know. In fact, I had a lovely comment today on Diane's group saying, you know, she'd bought a product, and, you know, it it was this one, and it was just brilliant, you know. And she had struggled, she'd rarely had any orgasms. So, you know, and also we have women who are struggling with pain, so on the lowest level that actually can help with their pain, because obviously sometimes people who've got vaginal or pelvic pain, using a vibrator, that can stimulate the nerves and that can cause pain.
Okay.
So, you know, but there are so many things. And then obviously there's toys for men, you know, people with a penis. There are some fantastic toys. There's constriction rings that vibrate, so you get clitoral stimulation, they get stimulation, it makes their erections last longer. But blindfolded sex, if you're sensory deprived, that heightens all your senses, your sense of touch, taste, smell. You know, actually don't know what's going on, it can sort of make you feel a little bit sort of, oh, you know, it just heightens your senses and your awareness, and it's a really fun thing to do. Just get yourself a scarf and, you know, just try that as well. There are just so many things that you can do in the bedroom, and we have to go beyond penetrative sex, because not everybody has penetrative sex. You know, they enjoy sex in so many different ways, but, you know, not all these toys are designed for penetration, and obviously some are clearly designed for a penis, some are, or a prostate, some are designed for a vulva or a vagina, but a lot of them are gender neutral. You can share them with a partner, whether they've got a vulva or a penis. So I think that's the thing about it. Have a look at the website, because there's loads of info on there. But I think be creative. It's amazing what you can actually think of. And actually, when I say to people, the bullet, don't just use it on you, use it on your partner. Have you tried it on his nipples? And they go, oh yeah, I did, and he loved it. You know, so it's thinking outside the box and actually thinking, you know, these toys, you know, just a simple toy, it's non-threatening. Don't bring a great big dildo into the bedroom, because that will be scary. And I've got one on my bed here, but I'm not going to show it to you. But, you know, that is going to scare somebody off. You know, and that's the thing, when you're choosing a toy, don't go for the biggest thing. Look at the power, the motors, is it rechargeable, battery operated, and obviously is it skin safe? That's the most important. So, you know.
Can I say something about Joe Devine's site that is not on most sites? Is they have wonderful little videos made by really knowledgeable women who actually, you know, they review the toys, and they show you how they work, and they show you the noise and the power of them. And I find that's really, really useful when you're not used to toys or you're buying online, because it's so hard to know when you just see a picture.
I think that's
also for that.
Yeah, and
I
probably
was just going to say also, people, other websites, they'll show you hands and then pressing, but, you know, I'll be there waving the toy around. You know, we've only just got back to doing videos again. I'm working with somebody new, but that's important. And then you'll get two people saying, well, I tried it like this, and I tried it like this.
I love that.
And you know, and actually I say, oh, I hadn't thought about using it like that. Well, actually that worked for me, but that didn't. And I think then that gives you a different perspective. And having an older woman who's had 3 kids, and a younger woman, you know, who's sort of in her first relationship or whatever, or different, you know, whatever relationship they're in, that's a really important thing. I think it's actually getting that perspective. You can hold up a toy and just say, well, this is what it does, you press this button, but you need to talk about how it feels and what sort of orgasm it gave you. So, you know, I think that's always, we're really honest with people. I think that's the thing about it.
And someone's just made a comment there that they did get some of your clitoral stimulation toys, and that they worked a treat that they got them from you, Sam. So
good to hear. I love to have feedback.
Just a practical question. So when you're using any of the toys, is it recommended like to use a lubricant or moisturizer, or what kind of guidance would you give on that?
We don't ever recommend a moisturiser, because they're not designed as a lubricant. So so obviously water-based lubes will work with any toy, any material. The oil-based, yes, is fine. When you get a sex toy and it says don't use oil-based lubes, they're talking about your olive oils and your cooking oils and your coconut oils and, you know, Vaseline, whatever. None of those.
Oil, mineral oils, or the things like baby oil.
Yeah. And basically, the oil base is great to use with our toys. And then silicone lube, you can't use it with a silicone sex toy because it will degrade the material. But obviously, that's fine with glass, metal, ABS, plastic. But yeah, I always say to people, we always sell lube, and people are really shocked. And then we often find out they're using something like KY or Asda or something from a pound shop, or, you know, we get Sudocrem, olive oil, baby oil, Germaline, Vaseline, you know, the rubbish that people are using because they think it's slippery. It's fine. You are damaging your intimate health, as Lavinia can tell you all about this. So we always say, because it makes the sex toy feel more pleasurable. You know, I don't have sex without lube. Unfortunately, KY damaged my sex life because I did that. But when I discovered yes, you know, it changed everything. The vaginismus went away. So, you know, but it's finding the lube that works for you, because obviously what will work for me might not work for you. So therefore, test things. You can get samples from companies. But, you know, please check ingredients, which Lavinia can tell you all about.
Yeah.
and using condoms, oil-based lube isn't going to be useful either. It integrates condoms within seconds. Actually, I always thought it was an exaggeration. So
no.
Tried it, and it's really.
We did it with our children. You blew up a condom and put the oil-based lube on it. It went pop. The other thing to say, people think they're allergic to condoms. They think they've got a latex allergy. It's actually ingredients on the lube. And a lot of condom manufacturers do not put the ingredients on the packaging. In fact, some lube manufacturers don't even do that, well-known lube manufacturers. Yeah. If you can't find the ingredients, then I would say don't use it. But silicone lubes on condoms are fine. Or, you know, non-lubricated, and use your own lube, like a water-based lubricant, you know. So that's the important. But, you know, a lot of people think they're allergic, and they're not. They're actually,
is it often silicone? Is it often silicone on a condom?
No, a lot of condoms have just got like a water-based lube of some sort.
But with horrible,
not particularly well lubricated. No. And the other thing to say, can I implore that people in menopause, if you're in a new relationship, use a condom. Yeah. Because yes, you may not be able to get pregnant, but you can get a sexually transmitted infection. Yeah. And STIs are rising in the over 50s, and we have to do something about it. Yeah, that's my sexual health message.
Yeah. Oh, that's good. That's good, Sam. Because you know what, I'm always forgetting to say that, and it is becoming, it's definitely becoming more prevalent here. The increase of STIs. Just when we're talking about moisturizers and lubricants, I know I had some messages in relation to what is the difference between, and when do you use water-based versus oil-based, and what's the difference? So Lavinia, that's probably one for you.
Okay, so the key difference is that a water-based lubricant is its first ingredient is water, but it'll have other things after that. And a lot of standard water-based lubricants will actually have parabens in them. They'll have glycerin, they'll have glycols. And those are the things that you want to avoid. Those are the things that can cause irritation. So a water-based lubricant is very natural. It feels like your real natural lubrication, but it will get absorbed fairly quickly, and sometimes it needs to be reapplied. It shouldn't be sticky. It should be pH balanced to the vagina, so it needs to be fairly acidic, between 3.8 and 4.5, and that should be on the packaging. But it feels very natural. So it's very often a personal preference as to whether oil-based or water-based is best for you. The oil-based is purely a natural plant-based oil. And I'm talking about our products because there will be other products out there that may be coconut oil, but ours are sunflower oil, sweet almond oil, shea butter, cocoa butter, beeswax, and vitamin E. They're all natural products. And as we said, not to be used with condoms, but they're a richer, longer lasting lube. Really good for masturbation, really good for the vulva if you've got any soreness around the entrance to the vagina, and they can be used on a daily basis. The oil-based particularly can be used on a daily basis to keep the vulva comfortable. Then for anybody that's suffering from a little bit of painful sex or vaginal atrophy, we recommend something called double glide, which is where you put the oil-based first, and then you apply the water-based over the top. You can put the water-based on your partner. And the benefits there is that the oil is giving you the protection and the longevity, and the water just slides over the top and feels really natural. So those are the two lubricants that we do. And I won't talk about silicone because it's not something I know a huge amount about. We're sticking to very natural products. And the difference between a lubricant and a vaginal moisturizer is that a vaginal moisturizer is designed to deliver the water a little bit more slowly over a regular basis over a long period of time. So you would use that very often every day or every other day just to help with any vaginal dryness or atrophy. And then you would still use a lubricant when you want to have sex. I think that's the key difference to understand. One is for moisturizing, and a lubricant is absolutely for sex and masturbating.
And that will bring us on to another question from a lady who is on Vagifem. She's very worried and very scared in relation to having sex. She said the area feels very inflamed, or has felt very inflamed in the past. She doesn't feel she's getting 100% relief with the Vagifem. What else can she do? Now, I did go back and I did just ask and say, are you using a moisturizer as well in between with the Vagifem? And she hasn't been. So I guess what advice would we give in that instance? I guess I would be thinking straight off to introduce a moisturizer as well.
Yeah, so I think if it's okay for me to answer this, because we work very closely with Nick Panay, who's the leading menopause specialist in London, working at Chelsea and Westminster and Queen Charlotte's, and he will always recommend Vagifem, and he will always recommend a slightly higher dose for somebody that is suffering from severe atrophy. So the standard recommended dose is every day for 2 weeks, and then twice a week. For as long as you need it. But the dose is very, very small. It's a 10 microgram dose, whereas it used to be a 25 microgram dose. So many GPs and healthcare professionals will recommend that it's okay to have it more than twice a week. Some people will have it 3 times a week. Some people will even take it 5 times a week. And there's still a very small amount of estrogen in that amount. But Nick would recommend that you would use a vaginal moisturizer such as the SVM on the other days that you're not using the Vagifem.
Yeah.
They work very happily together. They work in combination. I think, Sam, that's something that you found really helpful.
Yeah, I mean, I actually have a history of thrush and bacterial vaginosis, so I use the Vagifem 3 times a week, and then the VM on the other days, and then I use oil-based and some other lubricants for sex as well. But yeah, it has made a huge difference. Touch wood, no infections or anything for a long time.
Well, that's the key thing, is by using a pH balanced moisturizer and a pH balanced lubricant, you're going to keep that vaginal environment fairly acidic. And that a lot of our customers tell us that they used to get a huge amount of thrush, bacterial vaginosis and UTIs. Yeah. And actually just moisturizing the vagina will also help with those urogenital symptoms that are not actually an infection. They're just the fact that the tissue is very dry, and because the bladder and the urethra also have estrogen receptors, by just moisturizing that whole area, that can sometimes help with those symptoms of urgency and frequency that are not actually an infection. They're just a side effect really of the atrophy.
Okay.
And I'd like to add as well that dryness is not always just internal. So the Vagifem is a pessary, and so if you find that you are, so that the estrogen creates plumpness, and when we start to lose estrogen, we lose plumpness, and we can lose condition on our labia and on our, the vulva, the external, and that can be really uncomfortable as well. So if you find you're not getting relief for that part of your body from using that, you can obviously the moisturizers will help with that. If you still aren't getting enough relief, you can get something like Ovestin, which is a topical estrogen cream, and just pop a little bit of that on the external. Some women tend to get very sore around their clitorises for the same reason. So a little bit of topical estrogen can work wonders for that.
Mm-hmm. Yeah.
So you don't need to suffer. This is the message. You don't need to suffer. If you are suffering, there is more that can be done. And if your doctor isn't willing, this is particularly for Irish people, I don't know what it's like in the UK, if your doctor is not willing to help you with this, go to another doctor, because there are GPs who understand and who are educated up to current standards now.
Yeah, big time.
Still pretty few and far between, as we know, don't we, Catherine? Yeah. But they do exist.
Yeah, we're the same in the UK. It is, women are having to fight to get Vagifem, and they are then giving it for a month and then told, well, you'll get better. It's for life. I plan to go on taking Vagifem until I leave this earth. This is like you moisturize your skin. You need to be looking after your intimate health, and that's the most important. Again, washing with using bath bombs that I call thrush bombs. you know, bubble bath, all those things. Again,
yeah.
look, your scented menstrual pads. We've even got
No, don't. Yeah,
Oh,
I mean,
yeah.
don't need this stuff.
Yeah. I shared this on social media last week. I was working with a woman who put a terrible concoction of things internally in an attempt to alleviate severe vaginal atrophy, and obviously ended up in a really, really raw place. But we definitely, you know, that's something, you know, the vagina is self-cleaning. There's absolutely no need to be putting shower gels, which was one issue, and other things, because honestly, it's just going to make things a lot worse. I know someone's just said few and far between do we have menopause clinics. I have been working with a lot of GPs around Ireland. I've been interviewing different GPs who I have found through investigation and through kind of word of mouth and chasing them down, have gone and done further training in menopause. So if anyone is struggling with their GP, I would say drop me an email, give me a call, and I can give you, you know, I might be able to point you in the direction of someone locally to you. I think unfortunately one of the issues we have in Ireland is that going to see your GP is it's paid for here. It's not like in England where it's mostly free. So and a menopause consultation, as we know, Emily, isn't a 5-10 minute GP consultation. So it becomes just a bigger issue for GPs in terms of timing and so forth. But there's definitely GPs out there who are trying to kind of expand and keep themselves up to date.
I don't think we have menopause clinics, though, do we?
No, well, not like you have in not like you have
Not
in
like
the UK. Yeah,
for that.
yeah. I sorry, just on that, I do know there is, I won't call it a menopause clinic because it's not pure, well, it's early menopause. There is a POI clinic, premature ovarian insufficiency, now being run out of Holles Street by Dr. Kathy Allen and Dr. Deirdre Lundy, but you can only have access to it on a referral from your GP. But it's fantastic, it's now in operation. It was delayed slightly due to COVID, but for anyone with POI, that's a great resource. Just moving on, in terms of questions, this is a lady, she's 34. She's in the early stages of hormone positive breast cancer. She's now on Vagifem. She has vaginal atrophy. She has no libido. She is feeling quite overwhelmed, depressed, and very fearful of the pain. So what else can she do? Now, if I'm recalling it, there was quite a few emails, but I think on this one, there may have been a complete lack of connection between the oncologist and so forth in terms of, I don't think she was given any notification of menopause, so she's doing a lot of trying to find out herself.
Yeah, I think it's great that she's been given Vagifem. It's very it's a tricky one, this, because there isn't a huge deal of evidence yet out there, it's a discussion that every woman that's had breast cancer that has vaginal dryness needs to have with her oncologist, and they'll have different opinions. But there is some good research out there that seems to suggest that it is safe. But it is a conversation that everybody needs to have with their oncologist. But Sam, I would have thought some dilators might be something that somebody like that, yeah,
definitely. I mean, this is something that the fantastic book by Dr. Liz O'Riordan, she's had breast cancer. I've written an article about sex and breast cancer. I've done a video which is on the website, and Liz is on there, her link is on there. And basically her thing is have a bag of tricks. So lubricant, dilators, and a simple sex toy. And that is her thing, have a bag of tricks. There's lots of practical advice on the website, but Liz is doing a lot around this, because we've had even recently had a Twitter conversation about Vagifem, and the fact is women are not being prescribed it, and basically oncologists saying go to your gynecologist saying go to your oncologist, or go to your GP. They're all passing the buck because no one wants to take responsibility. It's about quality of life. It's actually about, you know, you've been through breast cancer and you're coming through the other side. She's incredibly young. You know, I spoke to a lady recently, she was 30, you know, and she said, you've given me hope. She bought dilators, lube, moisturizer, a simple sex toy to use with her boyfriend. you know, she says, you've given me hope. Well, actually, healthcare professionals should be doing this. If you're, you know, this is the thing about it, and people are so fearful when they've had a gynae cancer or breast cancer of the pain, or their partner's worried about hurting them. This is a conversation we often actually have with people, and we say, well, you know, talk to your partner and actually say to them, well, touch me there, that feels okay, well, let's do this. Yeah, I mean, our dilator kit's great. There's a video on the website. Again, I always recommend using that with the Yes oil base too. And they're sort of, you know, they're not clinical, they're pink, and you know, so they're really flexible, and they're made from beautiful silky silicone, and basically it's a way of getting back into enjoying sex. You have to think beyond penetration, you have to think of intimacy together and the touching, but yeah, very much. But the article's really informative, and there are links to Liz and also to Jo Taylor, who set up ABC Diagnosis. She has secondary breast cancer. You know, some fantastic people out there doing some really, really good work who are living with breast cancer.
And is that on your website, Sam, or where can we get that?
What, sorry?
Sorry, where were you saying that information was?
It's on my website.
Yes,
it's on my website, but the links to the people are on my website too. But the article's there. It's a very long article, and there's a video of me and Megan talking about.
So that's JoDivine.com. It's pretty easy to remember.
And Catherine, just quickly, I'll share with you afterwards the links to the two studies that Liz O'Riordan sent me yesterday, so that people can actually have, and they can take that to their oncologist.
That'd be great. Oh, that would be so helpful, Lavinia. Okay, there's some more questions coming in here before I go back to the other ones. Sorry, we're jumping around here now a bit, but how does it work with oral sex and intercourse on Vagifem and moisturizer days?
That's an interesting one. I mean, the Vagifem is very high up, goes up with an applicator, is very high up in the vagina. So I wouldn't have thought that was too much an issue. As far as our vaginal moisturizers, lubricants are all made of food grade products, so they're absolutely safe, and they don't have any flavor or any taste or any smell. They have no perfume, so they're all completely safe for oral sex.
I put mine in after I've had sex, so I put mine in at night. So before I go to sleep, if I remember, I have to have an alarm on my phone. But you know, I wouldn't put in my Vagifem before I was going to have sex.
No, that's absolutely.
I have sex, and then I pop it in all with the moisturizer. So you know, it's not an issue at all.
And if you're not in a relationship and you're having sex and you're using these things, then you know, and you're talking about oral sex or not, or you know, protection is really important, as Sam said, and it's, you know, it's up to you. Obviously, it's not talked about enough, and it's not talk about condoms having a stigma and people having blocks about them. But when it comes to receiving oral sex for women, you know, dental dams are important these days. They're important, and if you're using a dental dam, you're not going to have to really worry about taste or flavor anyway. But you know, I almost feel weird. I almost feel bad talking about dental dams, because it's like the people are just like, it wrecks everything. What? I can't believe you're talking about putting something over. That's just rotten. Well, not as rotten as STIs.
And also the HPV virus, also, which causes head and neck cancers, and we know they're going up. So again, and also if you haven't got a dental dam, they're not widely available. We were going to sell them, but there's no interest, which is weird, I know. But you can't get hold of them. So cut down a condom. I mean, I know it sounds daft, but you can cut it and slice it down the middle, open it up and pop it over the vulva. Or, you know, if anal sex, you know, if you're rimming, I know that's probably something I shouldn't be talking about, but, you know, anything like that.
Do talk about it.
You know, we haven't talked about anal sex, but yes, do a lovely anal lubricant, which is water-based, and that's brilliant, and it's great with some of our male sex toys as well, because it's thicker than the vaginal water-based, the other one. But yeah, that you can cut them down the middle and open them up. But yeah, you're right, because people don't seem to realise there's a HPV virus, and that can cause
just so common. Just so common. You know, so I think, you know, there are ways around all of these issues. The most important thing is that you use your Vagifem and you use your moisturizers so that you're comfortable. That's way more important than anything, because you're not going to enjoy the sex you're having if you're not comfortable.
Yeah. Sorry, now I'm just thinking of the list here. What do you think of coconut oil as an external moisturizer along with Vagifem, Replens? 34-year-old here with extreme tightness pain. Okay, can I just say Replens, please? No. Personal view, no to Replens. So Sam, I think you want to answer that question.
Well, it's different views. I mean, a lot of healthcare professionals recommend coconut oil. It is a preference, but there is research to show that it can cause thrush. And I know there's a bit of coconut oil in the oil-based applicators to get it out, but it's medical grade. It's not a pot off the shelf in the supermarket. And you know, you need to, that's the thing about it. But yeah, Replens, it's the #1 prescribed moisturizer in the UK, and quite frankly just put it in the bin.
Yeah,
we hear terrible stories about it.
Yeah,
but it's not
it's the exact same here.
It's not the only one though. There's so many. So you know, but coconut oil is the choice, and I know a lot of people love it, and it's finding what works for you. But again, it will destroy condoms. So,
I like it as a moisturizer. I like it for masturbation. I like the smell of it, and I like getting it all over my legs and my tummy and everything. I like it, and I do use it out of my kitchen, and then I pop it back for other people to use.
But I'm presuming it's extra virgin coconut oil now, Emily, that you're using.
That's the only thing virgin about my experiences.
Oh
it
Lord!
Is organic, extra virgin for sure. Yeah, I get good quality. Yeah, because I'm worth it.
Yes, yes. I just wanted to just mention this one from one of the viewers. Taking notes to pass on to my mum in Cork as well as for myself. She's once again got a presumed kidney infection, but the urgency might be helped with Vagifem, as you mentioned. I would very much say, particularly for older women, yes, you have to look at whether there's something more than a presumed urinary tract infection or a kidney infection. So I would definitely, maybe what I would say, well, I don't know if you're in the same place as your mum, but it might be beneficial if somebody maybe went to the GP appointment with her, because she may not feel assertive enough to kind of push the fact that, listen, you know, I want you to check. I want to see if there's something more going on here than just presuming it's a kidney infection. One of the things that I've been talking a lot about, if anyone follows me on social media, I'm always saying, don't presume it's thrush. I'd say the same about, you know, don't presume it's urinary tract infection. More often than not, it's vaginal atrophy and vaginal dryness that are causing the symptoms.
And don't allow your doctor away with it. Don't
big time.
But it's not easy it's not easy when you're battling against your GP. But you don't have to keep going to a GP if you keep getting put on antibiotics or whatever, and there, you know, nothing's changing for you. Don't keep doing that to yourself. Get another opinion.
Yeah.
I think it is important to have a urine test, but then there's the other issue that a lot of the urine tests are not fit for purpose. So that's a tricky one. But I must say, Catherine, I took my mum in her 90s to the GP because she was getting feelings of urgency, and she was getting negative urine tests, and she didn't seem to have an infection. And I demanded that the GP put her on Vagifem, and yes, and dear thing, in her 90s, she was happy to use a Vagifem applicator with a pessary. Wow. And a lot of those symptoms just subsided. But I think if somebody's got a kidney infection, they really do need to investigate whether there is something going on in terms of urine infections.
Yeah. And not antibiotic after antibiotic. Another one, I've had a total hysterectomy, surgical menopause, vaginal atrophy, no pleasure, no libido, feel very sad. Any advice? I think we probably covered that. Do you think?
I've got an article, sex after hysterectomy, on the website as well. I think we've done a video.
Brilliant.
Too, so
okay. What I might do tomorrow is I might just try and do a short video on your website, Sam, just pointing people or some posts to some of the things we've mentioned tonight.
Can I mention something that's very helpful? So when you've had a total hysterectomy, which I have too after endometrial cancer, is that when they take your cervix away, your vagina is a lot shorter. So if we are talking about penetrative sex, and if your partner is slightly on the large side, that fear of that pain that you can get, because the top of the vagina is not the same shape as it was when you had a cervix. It's narrowed off. It's like almost like bunching a pair of tights together. So what happens is if the penis comes up into that area, you start to get a feeling of a Chinese plan against, as well as the atrophy that you're suffering from having had a hysterectomy. So there's a product called the O-Nut, which is a really gentle wearable device that your partner can put on his penis, and it's like a little circular donut, and it just stops it shortens really the amount of penis that's in the vagina, and gives you confidence to feel that it's not going to hurt.
Or use a slim vibrator. So again,
yeah,
that's the owner.
There's the O-Nut. Well done. There's the O-Nut.
Very good, Emily.
And positions as well, being in a position where you can control depth of penetration, so not doggy
So look, they come apart, so you can have as much buffer as you want. You can have, and there's actually a fourth one there. So they're very squashy, they're very comfortable. They go around the base of the penis, and they just
any size as well. They stretch for any size penis.
They stretch, yeah, they stretch. They're wonderful.
So for people who are well endowed.
Ouch, Emily, ouch.
So those are available from my lovely colleague Elle at Pelvic Relief. She sells them. I don't know, you don't sell them, do you, Sam?
No.
Okay.
So yeah, and I think Stress No More sell them as well.
Would you email me? Would you mind emailing me those? And I'll post them tomorrow.
Yeah.
Okay. Just we'll try and crack on. We're at time, but let's just try and get through some of these. Catherine, on your last webinar, you talked about masturbation. I have tried, but I feel so awkward and like it's not right. I'm Catholic. I still feel self-pleasure is wrong. It's like, I know we've talked about that earlier. Now, there was several messages kind of along the same lines as that. I guess.
Can I answer that a little bit and just to say, it's practice. You start feeling that way. There's nothing unusual that you're feeling that way. It's your choice. Do you want to get past that? Because if you do, you have to stay with the discomfort, keep practicing, and mentally I have found that giving yourself permission really, really is key. So if you're touching yourself while thinking, God, this isn't right, I don't know if I should be doing this, is this a sin, is this dirty? It doesn't work. You've got to watch your internal dialogue and change that. You don't have to change it to, oh, I'm a sex goddess and I'm going to come all over the place. You can just change it to something simple like, I'm just trying to see if I can have pleasure, or it's natural to have orgasms, or it's normal for women to feel pleasure. You just change it to something quite simple and neutral that you can believe, but you have to interrupt the thoughts. And you have to keep interrupting them, because you have to build a whole new thought habit. The other thing to do is focus on your breath and make sure you're breathing, because if you're thinking that way, or if you're uncomfortable, you could be holding your breath or shortening your breath, which will limit your level of your potential for pleasure. So thoughts really important. Giving yourself permission to be a healthy, normal, natural person is really important. Breathing really deeply helps your body not to go into worry and not to tighten up, and it allows you to feel more pleasure. And then practicing that, and be gentle with yourself. Don't expect to feel massively different quickly. You want to be doing it at least 3 times a week. You want to be approaching it with an attitude of self-love and affection. And start with non-sexual, non-genital touch. Get used to just loving your body and feeling your skin and breathing into that, and giving yourself permission, first of all, to feel love from hands and to feel pleasure from hands, and build yourself up slowly and give yourself a break. You're coming from a place of shame and a place of, and so it's a lifetime of that takes time to change. So don't give up. If it's what you want, don't give up.
And I think everything you've said there will this next question, and the reason I'm going to read this out was because the person asked me to read this out, because they felt it was very prevalent to Ireland. For that reason I'm going to say the question. We're not going to delve into it too much. I think Emily has touched on it, but I am doing a session with Diane Danzebrink on past trauma in October, and this is where we will talk about this more. But I was abused as a child, and I'm really struggling now with sex. I have been fine for many years, but now I'm struggling big time. I've done therapy, but I feel it's coming back, and I cannot open myself up to it. One of the things that I would say is past trauma can become very current in menopause. If there's issues from your past that maybe haven't been closed off or haven't been fully dealt with, they tend to come back up in perimenopause or menopausal years. I think some of the what Emily has said there certainly, you know, would help in terms of some of that. But this is it's a bigger conversation, and we found from the last webinar there was a lot of issues that came up in relation to past trauma, and I had spoken to Diane afterwards, and we said we'd do a separate session just to kind of talk about that. I think Emily and I would know ourselves that it's an issue. It's quite a big issue here in Ireland, as I'm sure it is in other countries too.
It is, and just to say to people that it's a lot to expect yourself to be healed when the therapy that's offered in Ireland generally for people who have come through sexual trauma is about freeing the mind and lessening on the mind. There isn't really, as far as I know, any work that's done with the body, and the body stores the trauma. So depending on the stage of life you're at, what you're getting up to, how safe you feel in your relationship. Funnily enough, feeling really safe in a relationship can be enough for somebody to release. But you know, learning how to touch yourself, it could be any number of things that can trigger a release of energy and trauma from the body that is physical. So doing therapy to come to terms with having been traumatized is absolutely vital, but it's the first stage of therapy, I think, for sexual trauma recovery. As a trauma survivor myself and as a therapist, the bit that we need to then look at is, how do I enjoy my body? How do I enjoy sex? How do I know the difference between safety and danger? Because that can get really muddled. And what do I do when I get these feelings in my body? What do I do with them? Because that's not generally covered by the therapy, as far as I know, that's offered in Ireland for trauma. There's a lot of help out there to help with the body memories of this.
Yeah, and I think I did have a separate email conversation with that lady, and I did suggest, Emily, that she should connect with you, because I think, you know, certainly she kind of needs more one-on-one direction at this point. I think there's one we've covered. I think we've covered most questions indirectly or direct, you know, as we've chatted. If we haven't covered anything, and anyone has any other questions, they can just email me, and I can either come back to you or I can send on to the panelists. What I would say is, you know, thanks to Lavinia, to Sam, to Emily for the fantastic information as always. And you can contact Lavinia through Yes Organics or on your social media pages. Sam is joedivine.com is your website, and Emily's website is empowersme.com. And as everyone knows, you can contact me through wellnesswarrior.ie. And what I would say is, you know, do sign up to my newsletter. October is World Menopause Month, and for the week of October 18th, I have a series of interviews which I'll be doing throughout the week. So make sure and sign up to the newsletters, because you'll get notifications, and some of them will be panel interviews like this, others will be more one-on-one pre-recorded and so forth. But do sign up to the newsletters if you get a chance. And thanks again to my fabulous panelists. I'll be off ordering on Joe Divine over the next few days.
Sorry, can I just say we've got a code for you. It's a 10% discount code.
Oh, thank you. Oh, thanks.
Wellness 2020 till Halloween. So get your orders in before Halloween, and you can have a very
2020.
Wellness 2020.
Wellness 2020.
Okay. Oh, that's brilliant, Joe. Thanks a million. I'll put that up on social media as well tomorrow. Thanks so much. I'm going to stop the recording now. So good night. Thanks to everyone who's watched. Good night, everyone. And thanks to the lovely panel. Thank you.
Thank you, Catherine.
Thank you. Bye.